So a flat foot is when someone has lost the medial longitudinal arch of the foot. So on the big toe side, you typically have a little bit higher arch than you do on the outside or the pinky toe side of the foot. And so when you've lost that, you can have pain on the inside of the foot or the arch of the foot, on the inside of the ankle. You tend to progressively notice that the arch will collapse. So once it starts to collapse, it usually continues to progress. And you can even notice that the toes begin to kind of drift outward a little bit and point out to the side as opposed to pointing straight ahead as you're walking. The progression of flat foot takes months to years. It's not something that you would necessarily notice over days or weeks unless you have a traumatic rupture or injury that's causing a flat foot, which can occur, but that's not the typical flat foot that we see. You can have a congenital flat foot, and that's not something that necessarily needs treatment. In general, we don't address a flat foot with orthotics or surgery unless the patient is having symptoms. If they're not having any pain or any issues with the function of their foot, then it's just kind of one of those things, that's the way you were made. So the reason that the medial longitudinal arch will collapse is usually contributed to by a tight calf muscle. When the calf muscle is tight and it increases the tension across the Achilles tendon that tries to point the foot like a ballet dancer, and the ground, as we're walking, we don't walk on our tiptoes, and so because of the force of the ground and the tightness of the Achilles tendon, the arch gets extra stress and over time can succumb to that stress and collapse. So treatment for flat foot is typically reserved for those patients that are having pain or are symptomatic from their flat foot. So if you're walking around and happen to know that you've had flat feet your whole life and they've never bothered you, we don't even attempt to correct that. But if you're starting to have arch pain or you're having pain along the inside of the ankle or even the outside of the ankle, typically, again, we always start with non-operative treatment. So that would be orthotics. Sometimes we can do injections. However, we try not to inject tendons due to risk of rupture for tendon injection, and physical therapy to try and stretch out the calf muscle as well as strengthen the tendons and ligaments that are supposed to support the arch. Flat feet is something that we see often within the foot and ankle clinic. A lot of people coming in with medial arch pain or lateral ankle pain find out that they have flat feet, and that is the cause. The majority of patients that come in for flat feet are able to be managed pretty well with conservative treatment that gives them pretty good pain relief and allows them to continue the activities that they enjoy. I would say probably 30% of patients end up having to go on to surgery, and that increases with time. So maybe for 5-10 years you've done really well with orthotics and with physical therapy, but as time progresses and your flat foot progresses, eventually you reach a point where the pain is just too debilitating. Similar to a lot of other foot and ankle conditions, it's up to the patient when it's time for surgery. If they have a flat foot and they continue to have pain after we've tried therapy and injections, then that's when we discuss surgical management. There's actually multiple different options for treatment for flat feet as far as surgical approaches, depending on the flexibility of the foot and how mobile the foot remains and how easily we are able to correct the flat foot manually in the office, as well as how much arthritis the patient has, will determine what surgical option we choose or we recommend. So sometimes we're able to do that with what we consider to be joint sparing surgery, meaning that we're not fusing any of the functional mobile joints, so we don't stiffen the foot at all with surgery, and it's mostly osteotomies and tendon transfers and maybe gastroc lengthening or calf muscle lengthening. However, sometimes if the foot is more stiff and rigid, or if arthritis has already set in, or if it's an older patient, will elect for arthrodesis, which is the same as a fusion. So we'll fuse the hind foot to stabilize the arch and to improve the function of the foot.